Hi, my name is Stephanie, and I did stem cell therapy to cure Hodgkin's lymphoma. I chose to focus on the ability to cure Hodgkin's lymphoma with stem cell therapy. I have had a friend that had Hodgkin's lymphoma relapse 3 times. Watching what he went through with the aggressive chemo and radiation treatments made me wonder if there was a better way to treat this disease. Stem therapy has a stigma towards it by how stem cells used to be collected. Hodgkin's lymphoma has had several improvements in curing the cancer by using stem cell therapy. Stem cell therapy is expensive, and it won't be able to benefit people without some sort of financial help. Stem cell therapy is a relatively new way of treating medical problems. It has many different applications, but is still being tested before it can be a widespread cure. Development and the ability of harvesting and transplanting stem cells have made this type of therapy a less damaging cure. The main group of individuals I focused on was anyone that had Hodgkin's lymphoma, especially males. This type of cancer is widespread and happens in men more than women, so it is easier to find case studies that involve men, especially men between the ages of 20 and 35. Stem cell therapy has been successful in prolonging life in a patient if it is not completely causing the cancer to go into remission. Both of the case studies focused on using stem cells to cure or make Hodgkin's lymphoma go into remission. They proved that to do that, a patient is needed to be given multiple transplants of stem cells. The first case is about a 3-year-old in Japan, which is the first time it was used on a child. The other study is within a random group of people who were given transplants with traditional means of curing the cancer or making it go into remission didn't work. The first study was on a 3-year-old boy who lived in Japan who was diagnosed with Hodgkin's lymphoma. He was given multiple transplants of stem cells, but he died even though his life was extended to 500 days after his diagnosis. After he relapsed after his first treatment of chemo 2 months later, they decided that they would give him his first transplant of stem cells, and he ended up needing a total of 4. As stated above, the child's life was extended even though he ended up passing away later from complications from the Hodgkin's lymphoma. The stem cell therapy or transplant worked even though the child did pass away. The limitations is there was only one patient, and the test subject died after the transplants were completed, and we were not able to observe any long-term positive or negative effects from the therapy. If you look to the left picture on the screen, you notice an x-ray of the child's lungs, and there's white masses and tumors in it. This was taken before the treatment was started. If you look to the picture on the right, this is after the treatment, and you notice that most of the white obscurities and tumors are removed or gone. The second study focused on people who had relapsed Hodgkin's lymphoma, and they had chemo to treat it first. They were then separated and ranked on their sensitivity to chemotherapy. They took 37 of the patients and treated them with either autologous or allogeneic transplant, depending on which one would be better for them. The treatment lasted for 100 days with a 10% mortality rate. The stem cell transplant worked statistically better and was more effective at the beginning or the first few years after the transplant, and decreased to a 75% life expectancy after 4 years. Limitations is the stand was only done once and has not been repeated since, and it was done in 2010. And our technology has greatly improved since then, so transplants are not as dangerous, and stem cells are easier to get without causing any ethical problems or questions. If you look at the table, you notice that the life expectancy after the transplant is extremely high in the first 4 years, and once it hits 4 years, it drops down to about 75%. Based on what information I found, stem cell therapy is a good alternative to cure or put Hodgkin's lymphoma into remission over chemotherapy and radiation. Stem cell research and therapy progress with the technology as it gets better along with the procedures that can help more people and be able to turn this into a cure. As it becomes more widespread and it can give people another choice for what type of cure they want to try to put Hodgkin's lymphoma into remission. It is always better at a time like this to have more options during a time when the only current treatments, which are chemo and radiation, are extremely damaging to the body. One of my teammates did osteoarthritis, and the obstacles she found were time and that the insurance companies would not support or pay for the treatment until a certain amount of case studies were completed with a 95% success rate. Another one was varicose veins, and it was done on rats in Siberia, and Russia has a law that won't permit human trials, so that law needs to be changed so we can do the human testing. Next, which is heart failure, has the issues of cost, availability, and lack of research. The other one that we had was tissue regeneration in burn victims. This had a problem where people did not want to donate their adipose tissue after having liposuction. There are stem cells in the adipose tissue that would help with the burn victims. We all agree that funds were an issue along with the ability to get enough stem cells to do the therapies. One of the solutions I came with is the education of the public, how we acquire stem cells that don't require aborted fetuses, which most people leave, and we have many other options now today. Another would be having government funding to be able to do more studies and make it a common medical practice. Insurance companies also need to be brought on board to help with the cost since it's so expensive. Also, donation of stem cells need to be easier and readily available. I believe that we should have facilities where you can donate stem cells, like blood donation places that collect blood. Also, women can donate or sell their placentas after birth, since they are full of unused stem cells that were created as the baby was being grown. Also, most women throw their placentas away, and that's a waste of resources that we could use. We need more studies done and get rid of the stigma that stem cell therapy has, since the cells can be gathered different ways without causing death or damage to someone or something. Thank you very much for listening to this presentation.